Welcome back to Ionized Ideas, and welcome to part 2 of our radiation protection series. Thanks for joining me again as we continue this learning journey together. Grab your notes, settle in, and let's keep building your knowledge and confidence step by step. Stay with me through the series so you don't miss anything important. All the following radiation exposure responses exhibit a nonlinear threshold dose-response relationship except A. Skin erythema, B. Hematologic depression, C. Radiation lethality, D. Leukemia. The purpose of a secondary protective barrier is to protect from A. Primary radiation only, B. Primary and secondary radiation, C. Scattered and leakage radiation, D. Scattered radiation only. According to NCRP, the minimum total filtration, inherent plus added, for X-ray equipment operating at 70 kVp is A. 0.5 mm Al, B. 1.5 mm Al, C. 2.5 mm Al, D. 3.5 mm Al. Diagnostic X radiation may be correctly described as A. Low energy, low LET, B. Low energy, high LET, C. High energy, low LET, D. High energy, high LET. The most radiosensitive portion of the GI tract is the A. Upper esophagus, B. Stomach, C. Small bowel, D. Cecum and ascending colon. The exposure rate to a body 4 feet from a source of radiation is 16 R/H. What distance from the source would be necessary to decrease the exposure to 6 R/H? A. 5.8 feet, B. 8.3 feet, C. 10.74, D. 12.0 feet. What is the term used to describe X-ray photon interaction with matter and the transference of part of the photon's energy to matter? A. Absorption, B. Scattering, C. Attenuation, D. Divergence. What is used to illustrate the relationship between exposure to ionizing radiation and possible resultant biologic responses? A. Ionization chamber, B. Thermoluminescent dosimeter, C. Dose-response curve, D. Electromagnetic spectrum. Which of the following is true regarding dose reduction in fluoroscopy? 1. Intermittent fluoroscopy is an effective dose reduction method. 2. The shortest possible exposure time should be used. 3. The use of a grid is not recommended. A. 1 only, B. 1 and 2 only, circa 2 and 3 only, D. 1, 2, and 3. The interaction between X-ray photons and matter that contributes to the majority of the exposure in the useful beam is A. The photoelectric effect, B. Compton scatter, C. Bremsstrahlung, D. Coherent scatter. Which of the following is desirable features of a thermoluminescent dosimeter, TLD? 1. Small size, 2. Tissue equivalent, 3. Immediate readout, A. 1 only, B. 1 and 2 only, circa 2 and 3 only, D. 1, 2, and 3. With milliamperes, mA, increased to maintain output intensity, how is the SA affected as the source to skin distance, SSD, is increased? A. The SA increases. B. The SA decreases. C. The SA remains unchanged. D. SA is unrelated to SSD. Which of the following are acceptable ways to monitor the radiation exposure of those who are occupationally employed? 1. TLD 2. OSL dosimeter 3. Quarterly blood cell count, A1 only, B, 1 and 2 only, C1 and 3 only, D1, 2, and 3. According to the National Council on Radiation Protection and Measurements, NCRP, the monthly gestational dose equivalent limit for embryo, fetus of a pregnant radiographer is A. 0.1 millisieverts, B. 0.5 millisieverts, C. 1.0 millisieverts, D. 5.0 millisieverts. The amount of energy transferred to an irradiated object by ionizing radiation is termed A. Exposure, B. Absorbed dose, C. Air kerma, D. Effective dose. Radiation dose to personnel is reduced by which of the following exposure control cord guidelines? 1. Exposure cords on fixed equipment must be very short. 2. Exposure cords on mobile equipment should be fairly long. 3. Exposure cords on fixed and mobile equipment should be of the coiled, expandable type. A1 only, B, 1 and 2 only, circa 2 and 3 only, D1, 2, and 3. Which of the following determines the rate of heat dissipation in an X-ray tube? A. Anode rotation, B. kV, C. Focal spot size, D. Rotor speed. If the exposure rate to a body standing 7 feet from a radiation source is 140 Mr. H, what will be the dose to that body at a distance of 8 feet from the source in 30 minutes? A. 182.8 Mr. B. 107 Mr. C. 91.4 Mr. D. 53.6 Mr. The annual maximum equivalent dose limit for the whole body of a radiologic student who is 18 years of age and learning the profession is A. 1 millisievert, B. 5 millisieverts, C. 10 millisieverts, D. 50 millisieverts. The annual effective dose limit for individuals in the general population is A. 1 millisievert, B. 5 millisieverts, C. 10 millisieverts, D. 50 millisieverts. Which of the following are considered especially radiosensitive tissues? 1. Bone marrow. 2. Intestinal crypt cells. 3. Erythroblasts, A1 and 2 only, B. 1 and 3 only, circa 2 and 3 only, D1, 2, and 3. Which type of personnel radiation monitor can provide an immediate reading? A. Film badge, B. TLD, COSL dosimeter, D. Pocket dosimeter. In what part of the GI tract does the majority of X-ray absorption occur? A. Esophagus, B. Stomach, C. Small bowel, D. Large bowel. The tabletop exposure rate during fluoroscopy shall not exceed A 5 Mr. per minute, B 10 R per minute, circa 10 Mr. H, D 5 R H. If an exposure dose of 50 Mr. H is delivered from a distance of 3 feet, what would be the dose delivered after 20 minutes at a distance of 5 feet from the source? A 6 Mr. B 18 Mr. C 46 Mr. D 138 Mr. If 2.5 mm Al is the required total filtration, and 1.0 mm Al is the inherent filtration, how much added filtration is required? A 0.5 mm Al, B 1.0 mm Al, C 1.5 mm Al, D 2.5 mm Al. What is the minimal lead equivalent requirement for the lead gloves used in fluoroscopy? A 0.1 mm Pb, B 0.25 mm Pb, C 0.5 mm Pb, D 1.0 mm Pb. In radiation protection, the product of absorbed dose, tissue weighting factor, and radiation weighting factor is used to determine A. Equivalent dose, B. Effective dose, C. Quality factor, D. Air Kerma. The classifications of acute radiation syndrome include all the following except A. Central nervous system, B. Gastrointestinal, C. Neonatal, D. Hematologic. The X-ray interaction with matter that is responsible for the majority of scattered radiation reaching the image receptor, IR, is A. Photoelectric effect, B. Compton scatter, C. Coherent scatter, D. Pair production. The dose-response relationship that indicates that any dose, no matter how small, will produce a biologic effect is the A. Threshold, B. Linear quadratic, C. Nonlinear, D. Non-threshold. TLDs and OSL dosimeters are heat or light stimulated to release energy. The amount of energy released is related to the A. Time between doses, B. Dose received, C. Dose rate, D. Total dose. The target theory applies to A. Spermatogonia, B. Oocytes, C. Lymphocytes, D. DNA molecules. What is the minimum lead equivalence required for a thyroid shield? A. 0.1 mm Pb, B. 0.25 mm Pb, C. 0.5 mm Pb, D. 1.0 mm Pb. The radiation weighting factor, WR, for X-ray photons is A1, B, 5, circa 10, D 20. The Bucky slot cover is in place to protect the A. Patient, B. Film badge, C. Fluoroscopist, D. Radiologist. The type of radiation that results when an inner shell electron is ejected and an outer shell electron fills the vacancy is A. Bremsstrahlung radiation, B. Characteristic radiation, C. Coherent scatter, D. Compton scatter. Which of the following refers to a regular program of evaluation that ensures the proper functioning of X-ray equipment, thereby protecting both radiation workers and patients? A. Quality control, B. Quality assurance, C. Continuous quality improvement, D. Quality congruence. Radiation output from a diagnostic X-ray tube is measured in which of the following units of measurement? A. Rad, B. Rem, C. Rentgen, D. Becquerel. The quality factor, Q, for X-ray photons is A1, B, 5, circa 10, D 20. The minimum thickness of a lead apron should be A. 0.1 mm Pb, B. 0.25 mm Pb, C. 0.5 mm Pb, D. 1.0 mm Pb. Which of the following is the unit used to express Röntgen, C per kilogram? A. Air Kerma, GIA, B. Gray, GY, C. Sievert, SV, D. Relative biological effectiveness, RBE. Which of the following affects the exposure rate of the primary beam? 1. KV2, MOS3, SID, A1 only, B, 1 and 2 only, circa 2 and 3 only, D1, 2, and 3. What is used to account for the differences in tissue sensitivity to ionizing radiation when determining effective dose E? 1. Tissue weighting factors, WT, 2. Radiation weighting factors, WR, 3. Absorbed dose, A1 only, B, 1 and 2 only, circa 2 and 3 only, D1, 2, and 3. Biologic material is least sensitive to irradiation under which of the following conditions? A. Anoxic, B. Hypoxic, C. Oxygenated, D. Deoxygenated. Advantages of anatomic compression during imaging include 1. Decreased patient dose 2. Improved contrast resolution 3. Improved spatial resolution, A1 only, B, 1 and 2 only, circa 2 and 3 only, D1, 2, and 3. Which of the following is true regarding a secondary protective barrier? 1. It protects against scattered and leakage radiation. 2. It usually measures 1/32 in Pb equivalent. 3. It may be a conventional wall. A1 only, B, 1 and 2 only, circa 2 and 3 only, D1, 2, and 3. Moving the image intensifier closer to the patient during fluoroscopy. 1. Decreases patient dose. 2. Improves image quality. 3. Decreases the SID. A1 only. B1 and 2 only. C1 and 3 only. D1, 2, and 3. Which of the following has a high atomic number and is especially useful in the composition of TLDs? A. TLD. B. Film badge. C. Lithium fluoride chips. D. Pocket dosimeter. Which of the following will result in increased patient dose? A. FOV increases. B. FOV decreases. C. FSS increases. D. FSS decreases. That wraps up part 2 of our radiation protection series. Thank you for watching and for spending your time here on Ionized Ideas. I appreciate you staying with the series, and there's more to come. Make sure to join me again for part 3 as we continue learning together. See you in the next video.